Dear colleagues, thank you very much for the opportunity to be here and to present here the lecture about the current trends in corneal refractive surgery. I'm very proud to be a part of the Sviatoslav Fedorov Eye Microsurgery Federal State Institution, founded by the well-known academician Fedorov, who made so many things in universal ophthalmology. That's why I slightly renamed my topic, and I would talk and I would focus mostly in Russian trends, Russian technologies in corneal refractive surgery. Of course, well known that refractive surgery is very safe and effective procedure due to high and precise refractive results, which can give that for the patients, and many patients can reach the visual rehabilitation very fast. That's why it's very popular. In 11 clinics of Sviatoslav Fedorov Eye Microsurgery Federal State Institution, we perform about 50,000 corneal refractive surgeries per year. And of course, it's not could be realized without the great history, about the great background which was before this. And of course, I would tell a few words about the history of refractive surgery, and mostly Russian refractive surgery. Of course, we know that Sviatoslav Fedorov elaborated and suggested so-called Fedorov cut, so radial keratotomy, which probably is not ideal for the long-term results. And now we can see some complications several years after the surgery, but it was the first technology which demonstrated that we can reshape the native cornea for the refractive reasons. That's why it was the revolutionary technology. Until now, about 5.5 million people were operated using this technology. Later, in the beginning of 18th, the epoch of laser refractive surgery started, and it was firstly demonstrated that exam laser can reshape the biological tissue without a terminal effect, with a very high and precise result. And it was the beginning of the epoch of exam lasers. At the same time, in Russia, in collaboration with the Russian Academy of Science, it was the creation of the first exam laser, which was called Profile 100, which used the Gaussian profile of energy distribution and allows to perform the transepithelial PRK, which still very famous for the correction of the refractive disorders in some cases. In next years, we have some third generation of exam lasers, which were developed according to the improvement of the technologies. And in beginning of the 21st century, the first exam laser with a flying spot microscan was created. Now we have commercially available a very good machine which is widely used in Russian and different clinics, not only in Russian but also in other countries, which have extremely high pulse rate, about 100 pulse rate. So we know that only 2 exam laser machine now has so high frequency of the pulse rates, and allowed to create the corneal refractive procedure not only according to the conventional way, but also using the Topo-guided, wavefront-guided, custom Q ablation and tissue saving ablation. In 2000, it was demonstrated that femtosecond laser is also available for the some refractive surgery needed for the flap creation. And at the same time, in Russia, of course, we also developed this technology which was realized in the creation of the commercially available first femtosecond laser, which we also use for the corneal flap creation with a very high and predictable results. So what we have now? We have three main directions for the solving of the corneal needings of our patient. And the first one is aimed for the keeping of the native corneal shape. Because of us, we know that cornea, it's not a sphere, it's the prolate ellipsoid with a negative Q value. And according to the conventional ablation, we perform it to the spherical or to the positive way with the induction of the high level of the spherical aberrations. And performing the ablation according to the Q value guided aimed for the keeping of the native form aimed for the increasing of the quality of patient needing and decrease the level of the high order aberration. We in our Russian machine, we also use this software which allows to examine and to keep the corneal sphericity much closer to the initial way. And here you can see the profile of the cornea ablated according to the conventional ablation with the high mid-periphery spherical aberration and the cornea which was reshaped according to the custom Q level ablation, which realized in the increasing of the quality of night vision in patients operated by the custom Q ablation. Another group of our patients came here for the correction after different damaging of the cornea, and all of them have the high corneal irregularity. And of course, the Topo-guided ablation, which is also available, allowed us to restore the corneal shape and to return into the initial level if it's possible. And depending on the level of the irregularity and depending on the absence of presence of the corneal opacity, we can do it according to the superficial ablation or sublamellar ablation. And we can perform this surgery after keratitis, trauma surgeries, and dystrophies. Traditionally, laser refractive surgery is performed only in case of very superficial corneal damaging, but we know that even partial removal of the opacity may be adequate for the patient needed because of the removing of the great part of the damaged cornea and correcting of the refractive errors and the corneal irregularities. So now we use it for even more deep opacities up to 2/3 of corneal thickness. So we use it according to the inverted Topo-guided PRK mode, changing the steps of the technology and performing the Topo-guided step first and then perform the PTK step, which allows to increase the predictability of the refractive results. And here's a very short example of the patient who were operated with these technologies after the herpetic keratitis corneal opacity. She has a very high corneal irregularity and very high level of the corneal opacity, and after surgery we can see much more transparent cornea and much more regular cornea with very high visual results. The last group of our patients need to plant reshaping of the native cornea form by solving some problem, for example, for the correction of the high degrees of myopia or performing the surgery of the very thin corneas. In this case, we perform so-called trans tissue saving ablations, which allowed us to keep at least 2% of the corneal tissue by correcting of the myopia, and with combination of the ultra thin corneal flap performed by femtosecond laser, it gives us the possibility to increase the volume of the corrected myopia. And long-term results of the correction give us a very safe, very predictable and very stable stable results, which were demonstrated by the 5 years examinations of the patients who were operated with this technology. So now we have several options, which allows us to solve many of the patients' needs and solve many of the patients of the problems. So what will be in the future? I exactly don't know. Maybe something like this will be one of the options which will allow us to correct myopia without any surgery assistance. I don't know, but in any way, I hope that the great future of our ophthalmology in the refractive fields is good, is quite accepted. And thank you very much for your attention, and thank you for inviting me for this meeting.